the Street Outreach Program, Nicole Gee from the Cayuga Community Health Network.
So good evening, City Council members, Mr. Mayor, community members. I'm Dr. Sherry Weiss. I'm the Executive Director for the Cayuga Community Health Network, and with me is Nicole Gee, the Director of Housing and Street Outreach. And we just wanted to come and kind of show you what has been going on with Street Outreach. You all were very generous and helped us to fund this, this program, and we wanted to come back and just show you what's been happening over the last year and a half. So I'll say a little bit about the history of the program. So we started in October of 2021, and the funding was split between the City of Auburn and Cayuga County Ledge. And we started with one street outreach and advocacy coordinator, and that was Nicole. And then we had to add a second staff person last year because the need had really escalated, and we were able to leverage some other funds. We got some support through the United Way and some other sources that were able to help us to add that second position.
So in 2021 when it started, I had 38 individuals and 3 families that were assisted. As you can see, the numbers have increased. 2023 alone, 66 individuals with less families that I was assisting. And that's just due because CAP and other agencies kind of really hug on tight to those families and replace them. So in total, 151 single individuals and 17 families were provided with services. Those services are, anything from obtaining employment, getting the emergency housing, getting them set up with more stabilized housing out of the hotels, the referrals if they needed medical attention, giving them the referrals for mental health appointments or CHAD appointments, things like that, services that they may not have known about.
And it's really important to know that those are the folks we count because there are a number of referrals and services and visits that happen. But there are dozens more that Nicole and Kira come into contact with, that they have a conversation, they talk about some of the things that they could do, but they don't accept or say, I'm fine, I don't need any help, or maybe it's just one quick phone call. So there's a lot more that even with this that goes on of the individuals that we've been able to provide some assistance to. This is just a brief picture of some of the encampments that we come across. We did the point in time count just last month, and these were some of the locations that we saw. These are still existing, and I'll mention that folks will say, well, why don't they just come in out of the cold, especially during Code Blue, and Code Blue allows for even folks who are sanctioned to be housed. And often the responses are because there are some restrictions. There are issues with they have a pet that they don't want to give up or need, and they can't house them with that, or they have a significant other that they want to be housed with and they're being told they can't. So there's just some challenges that happen that folks will opt to stay out in the cold because they don't have the option to do some of those things, and there are just rules around things that we have to navigate in the system. You want to talk about some services?
So again, the services provided over time, clothing resources, food resources, assistance with their applications. A lot of people struggle when you have 30 pages in front of you and you've got all these appointments that you have to make in order to be in the hotels. And so I will be at the hotel quite frequently, or somebody will call and I'll assist them through the application process. Again, life skills. Sometimes we have hoarding situations where their house is going to be condemned, so they're going to be homeless. We navigate how can we help, food resources. I can't tell you how many boxes of food we've put together to drop off to people. And again, giving them, the option of like SS Peter offering, all the food pantries that are available in our county. And again, just, the mental health, making sure that they have their medical is taken care of. A lot of people put that on the back burner when
and also financial literacy, so helping people make budgets, negotiating with current landlords to hopefully avoid, so this is both street outreach and advocacy, meaning housing homelessness prevention, hoping to avoid that by working things out with the landlord. So just to kind of give some perspective, I love to always say, how much bang for your buck are you getting? And this is a really good, now that we've had this program for a couple of years, we can really demonstrate the impact that it's having. There are limited shelter beds, as everyone knows. The hotels this year, and they've gone up since 2023, were $100 per night for an individual. Families could be $100 to $200 per night, depending on how many members of the family were being housed. The average stay is anywhere from 1 month up to 18 months. There are individuals that have been in the hotel for a very long time. Those in the hotel that don't have any support tend to stay between 1 and 5 months on average or more. So if you add that up, it costs between $3,000 to $15,000 per person. If we did not provide the services that we do, so again, there is more need than even we can fill. But with 2 people, we've been able to do much more. We could use a 3rd, to be honest. But if we didn't provide the services to the 66 people that we did in 2023, they could have stayed additional time at the hotels, even if they only stayed 1 additional month. That's a cost of $198,000. You know, so we're very pleased to be able to demonstrate to you that the small investment that you've made in our program has yielded, I think, a really high return.
So I won't read through all the success stories, you guys can do them, but I will pick a few. My one female that I had, she had 4 kids, her home, she had lost her subsidy through CAP because she'd been on it for a really long time. And so at this time, a mainstream voucher program had come through, which is through Auburn Housing Authority, which allowed this woman to not only, we had to work with the landlord, get him on board, he had to make simple repairs, everything was done, and it allowed her and she had like 7 or 8 cats on top of this, plus her 4 kids to stay in her home for the next, I believe 4 years is what she's covered for. So it allows her that time to kind of figure out or have a plan, instead of, again, that would have been a hotel of at least 2 rooms with a mom and 4 children, and then displace of all those cats too. So that was one success story. Another one that I really liked was, and I've only had it happen once, one of the, I don't know if he's the owner exactly 100%, but he's head at the Fox dealership. He had called me, stated that somebody had told him that I house people and whatnot, and so he was willing to fund everything for this gentleman, and in 72 hours we had him completely moved in. He was able to get his dog out of the pound, reunited with his dog, and he's still successfully there and working at.
And he would go every day to visit his dog.
Yep.
Because that was such a, that was his companion. So, and Nicole being able to do that was, and in that amount of time, that's a rare occurrence. Normally it takes quite a long time to find housing, get it situated, but this really lined up really, really well. Any more? Okay.
So yeah, and then obviously Senate Meadows, you guys all know that that's newer. I have successfully housed probably, I think, 4 individuals there that were living in their vehicles, but they met the criteria of everything, and they are all still successfully living there. And one of the things I do want to point out, not only are those numbers, per individual, per family, but I also continue. I will have some that will reach out that are struggling, and then we'll find a solution, come up with something, even if it's a visit, even if it's, so these are people who will continuously come back, where they're looking for that intensive case management piece. We can't obviously offer that, but we do our best to navigate for them. Even though they are successfully housed, we will continue to answer those phone calls and help out any way that we can, so.
Because it helps stabilize their housing. Sometimes it's as simple as, I can't get somewhere to get a money order to pay the rent.
Yeah.
And so we figure out a solution for them. So, and in any of the programs and services that are done working with individuals like that, it really is important to make sure that the follow-up continues, that there is support that continues, because where people fail is when they're done with the program and the program says, okay, good luck. Unfortunately, that's when people tend to end up back needing that with those high needs. And so this has worked out really well. We've been able to coordinate and help folks, and they don't, and sometimes they just want to tell us how good they're doing. And that one gentleman was living in his truck, and sometimes at McDonald's, actually, and it took a long time. He was
Year
a
and a half.
hard one. He, would come this close, and this is what happens, and then step away. Fear, whatever it was, and then finally enough things had happened. He said, "I'm ready," and he's been there ever since, and that's pretty cool. We're very excited about that. So, do you guys have any questions for us?
Councilor Kent?
First of all, thank you very much. It's a great presentation, and it's a tremendous program. I'm
Thank
really so appreciative of what you do. I just had a question about, and this is just, so how does the transportation work for these folks? So I just imagine you out there working, and then they have to get around. Do they use the busing?
So some do use the busing. Some will have like Medicaid kept to like their appointments and things like that. But when it comes to like grocery shopping, when it comes to go to get that money order for that rent, and they're out in Senate Meadows, there is no transportation unless they have the funds to take a bus. So I've been kind of talking to, Sarah over there, like, what can we do? Like, if there's gotta be another system, another way, like a credit card or something, So those are things that are in the works because it is a barrier when you don't have transportation, and, these people are coming from having lost everything to starting over, and, transportation is not gonna be something that they're gonna, have right away.
And this
if
is
at all.
mostly in the city, like the core group. And so I know that if you use the bus, you can buy, they probably don't have the money to buy tickets, but if there'd be a program to provide that for them, some funding, so that you had a pack of them that you
That
could,
would be helpful. Yeah.
that would be helpful. So
Yeah.
anyway, I just was thinking, when you were talking about how much activity is involved, and just getting all these things checked off their list, I just thought to myself, but you have to get there. You have to-
Yeah.
That is definitely a barrier for a lot of people. Fortunately for me, I can go to them, but then again, it still doesn't help
No,
I'm not transporting them,
No,
I'm not
exactly.
taking them where they need to go, so it's definitely a big, huge barrier, so.
Thank you.
I would just like to say, this is another program in the midst of all the other wonderful programs that we have here in Auburn to help those that need it the most. So I have a couple questions. So 66 residents, do you see that number growing?
Yes.
Oh, yeah, I'm
Okay.
already into the new year, and I usually average between 5 and 10 individuals or families a month, just by myself, that's not, and I'm
Counting
already
Kira.
at like 5 right now, I think, no, 6 today.
Yeah.
So, yeah.
And I think we've seen that exponentially going up, and I think it's going to continue.
And where are you getting the referrals from? This here says street outreach. Are you walking the streets to look for encampments?
Sometimes.
So my feet are my boots are on the ground. Yes. So there are times where I've had an individual who, I would like, for instance, I'll give you a little story. He had an abrasion on his head, and I was like, "What happened?" He's like, "I fell." You probably should get that looked at. So that was like a call to East Hill. Hey, I have a client, so now we're in the works with some East Hill stuff. And hopefully we can get like a like a vehicle that'll go out and assess and address those situations when people can't get to the hospital or they can't get, to the medical appointment or they don't have medical. Those are also issues too. So yeah, so my boots are on the ground. And as far as the referrals go, I pretty much collaborate with all the agencies, and I'm like, my brain is just filled with all the knowledge of agencies.
The phone
and
rings
what we
all the
have
time.
here. So oftentimes I will, and if I don't know the answer, I'm looking it up. Okay, what agency can I call that can direct me in the right direction to help this specific individual and the needs that they're asking for?
I want to piggyback something you said. Is there a greater conversation about like a mobile health or mobile medical
So
unit?
East Hill is actually working on that. They
Okay.
do have a van that's been outfitted for that. I think it might be a staffing issue right now, but they have plans for that. And I also know that Nick's Ride for Life got an Oasis grant in partnership with East Hill. They're going to be going out and assessing folks for drug and alcohol issues, but then they'll be able to refer out. They'll call Nicole and say, "Can you come and do the other stuff for us?" And so there is some, I definitely have a dream of at some point being able to have a van that could be our street outreach van that could go around, not just to the city, but to the other, because she also,
I do
we
rural,
lots of rural
Yeah.
folks too, but we know, this is the city council, we want to keep it focused on the city, but something like that would be incredible, because then we could go out to people and we might be able to do some transportation. So my wheels are always turning, always trying to find funding to support that, but that's something that's definitely on a list of, my wish list of making something like that happen, because I think it would be very helpful.
Absolutely. Definitely would help with the visits to our emergency room could
Yes.
decrease those. And my last question is, what barriers are you experiencing with housing?
Well, initially, not so much now, because I have a really good rapport with 3 landlords currently, who pretty much every time I call, I'm like, hey, what do you have? And they trust my instinct, and we get the person really in. But typically prior to that, I would say the cost. I mean, you're looking, most studio 1-bedrooms are $1,000 a month. I mean, and they're not budging, which I understand. Also, if those clients that I've had have burnt their bridge with a certain landlord, they all talk around here. So
Sure.
one conversation leads to the next, and then they're, not being rented to and whatnot. So I've done a lot of advocating. I just had a couple sit with me yesterday in the office who burnt a bridge with a landlord, so their name was kind of being thrown around. I had made a phone call to one that I've been working with, and they actually got to go yesterday to the apartment, and I think they're there now. But, again, it was that advocating, and if there wasn't somebody to be like, hey, listen, they're going to work with us, we're going to, help them with what they need, and et cetera. I don't know that would have been a situation for them or an option. But yeah, I would say between the amount, locations for people, and just the negativity around landlord versus landlord and what they talk about is definitely a barrier.
I also think sometimes it's things like financial literacy and life skills. And so sometimes that's the basic case management is, let me talk to you about, it's good that you take out your garbage every other day, and you should wash your dishes and sweep your floors. And those are things that we're probably, those of us standing here, I'm sure, you were taught that, but there are many, many folks who were not. And so sometimes the issues were just, they didn't, really know, oh, I'm supposed to mop my floor, keep things clean, take out the garbage to avoid pests. Some of those basic life skills, along with budgeting and understanding how much money comes in and how much you need that's going out. And that's a lot of the work we do too, because that's part of the negotiation with the landlord is, if I work with this person and make sure that they keep it clean and they don't trash the place, will you give them a chance? And that's sometimes what we end up having to do.
You don't get thanked enough, so thank you.
Thank you.
I just want to say I was there when you guys presented to the county ledge, and we were there to support you, and I was really excited about this program, and I'm incredibly impressed in what you've done with such a small amount of resources and even fewer individuals to help with it. And I really appreciate that you came back and showed us what you're doing and how that small investment was really worthwhile. I think that's, while it's very, very important to help people, it is important to let the community know that their investments are being spent wisely. So thank you very much for
Thank
that.
you.
Go ahead.
I just want to echo my colleagues' thankfulness and gratitude for all that you're doing. As Councilor Calarco said, this is a community issue, obviously, Cayuga County, but there's a lot of concentration of needs in Auburn. So thank you both again for doing and presenting.
Thank you.
I too will echo what my colleagues said. You're doing tremendous work. This was a very complicated problem pre-COVID. COVID only exacerbated that, and I think that it's going to go on for some time. There are people in crisis, and you all are there helping them. Ms. G, thank you for always taking my phone calls.
Yeah. Thank you for calling.
Yeah. You mentioned the gentleman from Fox, and I think that's an important case to mention because there are often misconceptions with people who are unhoused. Here's a gentleman who was working.
Yeah, he was working. Yeah.
I don't know that gentleman. I know the person who called you because he called me saying, how do I help this person?
Yeah.
And I said, call this person.
Yeah.
And he made a point to call me back and let me know what a positive experience it was, and he is very grateful for the assistance that you provided his coworker. I do have a couple questions. In your work, are we keeping track or monitoring where folks are from? Are they from Auburn and Cayuga County? Are they coming here from other places? Because I think there's some misconceptions that there's this influx of people from other
Yeah.
parts of the state and parts of the country.
So when I originally started, I had 2 cases that had come from Florida. I'm not sure why.
Nicole, can you get
Since then, sorry.
closer to the mic?
Since then, I haven't had any come from out of state, but I will tell you some clients that I've come across are from a different county. When that happens, though, they cannot receive services here. Their only option is to go down to social services. They can give them a bus pass back to the county they are from, and then they have to close out a case, and then they have to have a 30-day window to come back here to be able to, you know, receive. And at that point, they're like, that's just too much work, because that means they go without food stamps for 30 days. And you know, so, but anytime you're applying for emergency housing, if you're from another county and you try to come here, there's rules. So yes, it does happen, but they're not receiving, I can't help them because they're not Cayuga
Sure.
County.
And
So,
Commissioner Bianca would tell you, it's a very small number that even do come.
yeah.
It's, you know, it's single digits, honestly.
And most
So-
of them come because they're like, oh, I didn't get anything in Onondaga, maybe Cayuga can
Right.
help. And then once we tell them the same thing that they were told in Onondaga, they're like, crap, and then they just go back. So,
And I don't, it's hard when you talk about the subject, right? Numbers and quantifying things, because they're human beings, and that's not my point. I want to clear it up, because I hear a lot of things from people in the public that, oh, people are just coming here. There's an influx of people here, and so I think it was important to
Thank you for that, because it's your friends, your family, your neighbors.
coworkers,
That's
people you
your
went to high school
coworkers.
with.
And really, there's no, like, what does a homeless person look like? Look around. Because there's no set, you know, profile.
Sure. You mentioned city-county funding. Is it split 50-50, or is it?
Yeah.
It
it's
is.
Right now, it's 50-50, and the other funding we get is for the second position.
And my understanding, I know Ms. Haynes isn't here, our portion of the funding comes from CDBG. Is that, do you know if that's accurate, Ms.
I
Leeson?
think it's ARPA funding. I think it's
ARPA?
ARPA that is that.
Okay. I don't have any other questions. Everybody all set? Thank you both so much.
Thank you.
Our graph reports for January 2024, Mr. Dygert.
I don't really have anything outstanding on that. If anybody's got any questions, I'll try to address them.
Any questions for Mr. Dygert? Other business from the council? Hearing none. Do we have a request for executive session?
Not from staff.
Anybody from council? I do have one item made confidential by attorney-client privilege. We have a sponsor, Councilor Clarko, second by Councilor Kent.
Executive session, 5:53 p.m. Councilor Kent,
Yes.
Councilor Overstreet Wilson,
Yes.
Councilor Cuddy,
Yes.
Councilor Calarco,
Aye.
Mayor Genatino.
Aye, we'll be in recess for executive session.
Chuck, you got a little cold?
Oh, man, I've had it for like 10 days.
Oh, I
Just
can
a,
hear it.
it's a nuisance.
No, it's just a pain. And they last forever.
Yeah, take a test.